Imaging in abdominal trauma, lower urinary tract imaging, part 5, genitourinary tract imaging, urinary bladder trauma, more frequent implant injuries, conventional radiography used before, now CT cystography, replace it in many centers, has diagnostic accuracy about 100%. 5 types of bladder injury considered: type 1 contusion, type 2 intraperitoneal rupture, type 3 interstitial injury, type 4 extraperitoneal rupture, type 5 combined rupture. Interstitial injury, as we found this CT cystogram, vocal lenticular thickening of the bladder wall due to interstitial hematoma and muscular disruption. We found material delineating injury, also multiple pelvic bone fracture. This image demonstrates the peritoneal covering of urinary bladder. Upper part of posterior surface, this is male and this female anatomy. Upper part of posterior surface covered by peritoneal covering. Lower part of posterior surface of urinary bladder devoid of peritoneum. The superior surface of the bladder covered completely by peritoneum. Along lateral edges, as we found along lateral margins, peritoneum passes into lateral walls of the pelvis. This means that anterior and lateral part of the bladder devoid of peritoneum. This, as we see, vesico-uterine pouch in female, recto-uterine pouch, this retropubic space devoid of peritoneum, retropubic space. So this part which is covered by peritoneum. If trauma happens here, this is give us intraperitoneal bladder rupture. If trauma occurs outside covering peritoneal area, this implies extraperitoneal bladder rupture. This is 5 sites of urinary bladder trauma. Site 1, rupture of superior wall of urinary bladder, result in extravasation into peritoneal cavity, give what's called intraperitoneal urinary bladder rupture. This another sites give us extraperitoneal urinary bladder rupture. Here along retropubic recess, here along after bladder out, neck outlet, and so on. This intraperitoneal urinary bladder rupture, intraperitoneal urinary bladder rupture. We see extravasation rupture of urinary bladder occur along the superior surface, result in extravasation of contrast and urine in the peritoneal cavity. This area which is covered by peritoneum in the urinary bladder superior surface and the upper part of posterior surface. Lateral margins devoid of peritoneal covering. So if trauma happens here, give us extraperitoneal bladder rupture. This intraperitoneal bladder rupture characteristic image. We found also extravasation of contrast may be present in flanks inside abdomen, intraperitoneal spread. This extraperitoneal bladder rupture, we found Muller-Tuss sign. We found contrast present in the pelvis, subcutaneous fascia, retrourinary bladder, retrovesical, and so on, not present in intraperitoneal cavity. This extraperitoneal blood rupture, this combined intraperitoneal and extraperitoneal. Intraperitoneal confirmed by presence of leakage of contrast urine extravasation in the peritoneal cavity in between bowels. Extraperitoneal presence of contrast in the pelvis and subcutaneous tissue in the pelvis and in between pelvic structures. Simple extraperitoneal rupture. CT cystogram, we found extravasated contrast material confined to perivesical space. This contrast material demonstrates typical molar tooth appearance. Also, we found complex extraperitoneal rupture, as we found extraperitoneal perivesical extravasation with typical molar tooth appearance. extension present into rectus abdominis muscle as well as subcutaneous fascia, and as we see in surrounding fascia of camber, superficial fatty layer, and deep membranous layer extravasated contrast found, complex extraperitoneal rupture. This CT cystogram, we show the hysteresis of symphysis pubis with disruption of urogenital diaphragm, which allows contrast material directly into deeper membranous subcutaneous fascial plane and along scrotal subdortus fascia, as we found here. This complex extraperitoneal rupture. Combined intraperitoneal extraperitoneal rupture, we found free contrast material delineating loops of the small bowel, characteristic of intraperitoneal rupture. Contrast material insinuating into perivesical, perirectal space. This is extraperitoneal rupture, and the pubic rami, as we found, fracture noted. Intraperitoneal bladder rupture with hematoma within confines of the bladder. Intraperitoneal. This we found acute hematoma with walled-like appearance, which with confines of the urinary bladder. Also found fluid within peritoneal cavity. This is mixture of blood and urine. This is demonstrates classic appearance of intraperitoneal rupture with extravasated contrast material between loops of the small bowel and anterior pararenal fascia. This cystogram demonstrates heterogeneous attenuation of bladder dome rupture site. Bladder dome rupture site, heterogeneous attenuation.